Welcome, and thank you for participating in the 2020 Virtual PSW Educational Conference offering. We are grateful for everyone's support and efforts to adapt this year's conference into a digital format that will be shared with pharmacists, pharmacy technicians, and student pharmacists across Wisconsin. To record your attendance for this presentation, you must watch the recording and enter the CE code given during the presentation. All videos will be available in the continuing education platform. After watching the videos, you will enter the CE code provided to you during the session in order to record attendance and claim your CE. You may choose as many sessions as you are interested in. In order to get back into the virtual conference, please make sure to save the original sign-up email from the LecturePanda system. This link is the only way to get back into the course. You do not need to complete everything at once, and your progress will be saved until the next time you log in. CE will be reported directly into the CPE Monitor portal. PSW recommends that all pharmacists and technicians should regularly review their CPE Monitor portal for accuracy. If you cannot find your original email, please email info@pswi.org to have your individualized link sent to you.
Recorded from my COVID-19 free office at the hospital, I'm Mike Gillard, PSW President. We are truly living in unprecedented times. The 2020 PSW Educational Conference is for the first time being held exclusively in a virtual environment. Most of the content is being recorded and available for CE, including this presentation. The Wisconsin Pharmacy Residency Conference is being presented live via GoToMeeting throughout Thursday and Friday this week. CE codes will be available at the end of this presentation, but the live presentations by the residents, I encourage you all to click in on this Thursday and Friday all day. The residents have worked very hard all year and are looking forward to being able to present their year-long projects. And unfortunately, they can't do it in person, so please attend those as much as you can. The membership briefing at the educational conference and annual meeting each year is to highlight a few PSW activities and to celebrate the work we collectively support and lead. In the spirit of social distancing, I'm looking forward to providing you with a PSW membership update virtually. The full PSW staff and many PSW members are working from home amidst Wisconsin's efforts to #flatten the curve. But most of our members, Wisconsin pharmacists, pharmacy technicians, and student pharmacists around the state are at the front lines of the COVID-19 pandemic. Wisconsin pharmacy professionals have demonstrated resilience, adaptability, and everyday heroism, transitioning their practices quickly. We've seen community pharmacies bring medications to patients in a social distant environment. We've seen ID pharmacists educating their teams to prepare for surge capacity and reviewing the latest evidence. We've seen ambulatory care pharmacists conducting most or all of their patient care visits via telehealth. We've seen health system pharmacy managers and directors implementing PPE conservation strategies and adapting their staffing models. We've seen managed care pharmacists considering policy implications and anticipating drug shortages, and so much more. A profession working together at the front lines and as part of a strong healthcare team. Thank you all for all you're doing and continue to do to serve our patients. PSW is working hard to provide you professional support as you work to provide frontline care during this pandemic. Just a week ago, PSW offered an all-member policy and practice webinar update on factors related to COVID-19 in Wisconsin. And next week, we will offer a clinical update webinar. We've also developed a new COVID-19 resource page for Wisconsin pharmacy professionals. From a government affairs standpoint, PSW is advocating for you and working with the Pharmacy Examining Board, the Wisconsin Department of Health Services, and the Governor's Office to provide regulatory relief, enabling PPE conservation, surge response, and more. PSW will continue to use special member email alerts and the Fast Facts e-newsletter on Fridays to help you keep updated on these developments. Regulations are changing weekly and sometimes even daily. As we adapt in this time of public health emergency, We are working to deliver education and connection virtually. Please keep the ideas and suggestions flowing, and I know that together we can work to face these challenges. I'm pleased to report the state of PSW is strong. We've hit a record membership high of 4,572 members. This number includes more new practitioners, pharmacy technicians, and pharmacy students than ever before. Under the leadership of the PSW Board of Directors, the staff is cataloging and organizing the over 30 formal committees, boards, and work groups in PSW. Over the coming months, we will be working to develop consistency in structure and opportunities to engage in the many PSW volunteer and leadership activities. The current website features a page to showcase some of the current methods to get involved. We encourage you to check it out. Levels of engagement begin with simply signing up. Your membership is so important. Other opportunities are featured to sort of dip your toes in and participate in remote CE offerings. You can even get active and showcase a poster or write an article, or even be a leader and run for a leadership role on a PSW board. The PSW Board of Directors has approved a website upgrade. This new website is currently under construction. The staff will engage members and leaders in the design and functionality efforts with a plan to launch the website at the end of the year. It's a big project, as you can imagine, but we are working hard to bring it to you, fully mobile and incorporating the existing value of the PSW app. At the time of this recording, the legislative session is wrapping up. The state Senate has delayed their final floor date due to COVID-19 concerns. There are plans to take up legislation in early May. PSW has championed a lot of great regulatory and legislative activity over the past few months. PBM reform is needed nationally, and in Wisconsin, PSW is pleased to support bipartisan legislation to regulate PBMs in Wisconsin. This meaningful reform is being modeled after successful reforms in other states, and we've worked with state and national partnerships to shepherd this forward. This bill passed the Wisconsin State Assembly unanimously, and we look forward to the state Senate voting on the bill soon. In November, immunization legislation passed the Wisconsin State Legislature unanimously and was signed into law by Governor Evers. This law increases access to pharmacist-provided immunizations. It eliminates the need for pharmacists to have a vaccine protocol when following CDC guidelines, and allows pharmacists to immunize patients under the age of 6 in certain circumstances. It was a collaboration between PSW, Children's Hospital of Wisconsin, the Wisconsin Medical Society, numerous health systems, and the schools of pharmacy. This collaboration demonstrates our shared objectives of increasing access to immunization services for our patients and our dedication to working together to achieve common goals. Over the past year, we've had the opportunity to do some reflection and celebration. We've also had an opportunity to pay tribute. After a valiant 2-year battle against brain cancer, PSW CEO Chris Decker passed away in late July last year. In tribute to Chris, colleagues, friends, and family across Wisconsin and beyond honored him through gifts to the Wisconsin Pharmacy Foundation. In August, I had the opportunity to attend the dedication of a new social and event space pictured here at the PSW office, named The Deck. We celebrated Chris and the special dedication and a recent tribute supplement to the Journal of the Pharmacy Society of Wisconsin. That is now available on the PSW website. We've installed a plaque to recognize the contributors, and it looks amazing in conjunction with the newly remodeled PSW headquarters building. I'm also proud to share that the PSW Board of Directors, with the support of the Wisconsin Pharmacy Foundation, has joined with the Iowa Pharmacy Association to rename the Leadership Pharmacy Conference the Decker-Temple Leadership Pharmacy Conference. In recognition of the leadership of IPA CEO Emeritus Tom Temple and Chris Decker. They established this conference over 30 years ago. I'm a proud attendee of this conference 22 years ago. These 10 young pharmacists pictured here will join PSW and IPA officers and staff, as well as 10 selected young pharmacists from Iowa at the conference this year. We look forward to welcoming this group of bright leaders in pharmacy at the newly named conference this August. Our strength as an organization is a tribute to our people. Serving with the motto, members are the purpose of our work, the PSW staff, led by Interim CEO Sarah Sorum, have demonstrated strength and resilience and true teamwork. Over the past several years, and in particular over the last several weeks, when we made the decision to convert this conference into a virtual one. While the staff is working remotely as we speak, our investment as an organization in video conferencing technology has provided for a seamless transition to working remotely and carrying on our mission despite the circumstances caused by COVID-19. As we build on the strength of our organization, we are transitioning into a new era. The PSW Board of Directors has named a formal CEO search committee to select the next CEO for PSW. After a nationwide search, the committee is currently interviewing candidates. A narrowed pool of candidates will meet with the full PSW Board of Directors in late April, and an announcement of the next CEO will be made available later this year. Formal strategic planning this fall will support the transition of leadership. I'm excited truly for our work together in the coming years. These 4 points are the areas that we are focusing on. Create new opportunities to engage and build leadership skills of Wisconsin pharmacy professionals. Continue to support engagement and advocacy and provider status efforts. Develop a thriving pharmacy technician workforce that supports expanded roles for pharmacists and new care delivery models. And focus on diversity and inclusion within PSW so that we can care for diverse patient populations. PSW is committed to advancing pharmacy practice and has invested substantial effort into being innovators. These innovations are to propel the pharmacist and technician professions forward by making sustainable changes and serve targeted patients based on population health data. It is our goal that these innovations will be scaled throughout the state to advance all pharmacists and technician professions and improve the health of Wisconsinites. Along with all the other priorities, opioid safety remains at the forefront. PSW continues to focus on safe and effective use of opioids as America's health rankings shows Wisconsin ranks 25th in the number of drug-related deaths. The state of Wisconsin also named opioids one of their top 5 priorities in their Healthy Wisconsin plan. Looking at this data, published by the Wisconsin Department of Health Services, PSW has piloted projects in some counties that have been the most affected by opioid-related deaths and hospitalizations. These counties are shown by the darker shades on the maps. Our society is working with Ford Healthcare and community pharmacies in Jefferson County to increase naloxone dispensing through 2 approaches. Ford Healthcare is implementing an EHR-based clinical decision support toolkit developed by Cerner to improve opioid prescribing. One of the functions of the tool is to assess for naloxone need based on CDC guidance. If needed, an alert will appear and the prescriber is given the option to enter a prescription for naloxone. Further, PSW is working with community pharmacies in Jefferson County to assess for naloxone need and use the statewide standing order to dispense naloxone to patients. Together, we hope these 2 approaches will increase naloxone dispensing and save lives in Jefferson County. The data is being collected on both of these approaches and is being analyzed by the UW-Madison School of Pharmacy. If successful, there is potential for the clinical decision support tool and other learnings to be scaled state and even nationwide. PSW is also working with the Wisconsin Department of Health Services, the 3 schools of pharmacy, and 4 organizations in counties with high rates of opioid-related deaths and hospitalizations to increase naloxone dispensing. The goal is to increase evidence-based information on naloxone to help pharmacists and technicians provide the best care to our patients. Academic detailing sessions are brief, personalized encounters that have been shown to improve evidence-based care. Pharmacists at 4 organizations are trained in academic detailing and are visiting with their colleagues for short visits lasting approximately 5 minutes to provide the latest evidence on naloxone. Faculty members at all 3 schools of pharmacy have also been trained in academic detailing and are using their training to teach students how to talk about naloxone on their rotations. If one of your students asks if they can talk to you about naloxone for a few minutes, give them a chance. They have some great information to share. The Wisconsin statewide standing order for naloxone allows pharmacists in Wisconsin to dispense naloxone without a prescription to anyone at risk of an opioid overdose, as well as their family, friends, and anyone who may witness an opioid overdose. This new PSW webinar meets the training requirements to dispense naloxone through the Wisconsin statewide standing order for naloxone. To learn more about naloxone and the statewide standing order, go to the PSW website to complete the naloxone statewide standing order training. Wisconsin DHS has created a directory highlighting pharmacies that currently dispense naloxone through the standing order. The intent of this public-facing map is to help patients and families identify pharmacies where they may receive naloxone. If you would like your pharmacy to be included in the map, please email DHS. Our next update is on immunizations. PSW looked at immunization data to see where we are in comparison to other states. According to America's health rankings, we have some room for improvement in Wisconsin. We are not in the top third of states for many vaccines. Our best ranking is 11th for the HPV vaccine, while our worst is 46th for patients receiving pertussis boosters. Clearly, pharmacists can move us up nationally. What PSW and our partners at MCW have found from the WPQC data is the Wisconsin pharmacies administer almost 40% of zoster and 20% of influenza vaccines. However, there's an opportunity for pharmacists to play a bigger role in immunizing pneumococcal, hepatitis, HPV, and meningococcal vaccines. PSW also learned that the top barriers to vaccinating are more than what we perhaps think. It's not the reasons of patients' refusal, it's that patients can't get it for financial reasons, perhaps, or that they lack insurance coverage for the vaccine, or there's other responsibilities that take precedence over getting a vaccination. Pharmacists also do not consider knowledge and comfort administering vaccines or storage or ordering as barriers. They also said that demand from patients was not a barrier. To increase vaccination rates, we must improve patient access to vaccines. We can do so by removing barriers that stand in the way of patients receiving them from their trusted pharmacist. We are continuing to work to provide a consistent and comprehensive vaccine offering at pharmacies statewide. When pharmacies offer all ACIP recommended vaccines, patients know they can receive all their vaccines from their pharmacist, and prescribers can refer patients to their pharmacist for vaccines. We also are working closely with the Wisconsin Immunization Program to increase the usage and effectiveness of the registry. By making the registry more user-friendly and offering more trainings, we can have pharmacists upload patient data in a more streamlined fashion and increase interprofessional teamwork and communication. We are also attempting to revise payer policies to include pharmacies as a vaccine administration location to ease the process for patients to receive their vaccines. To help potential patients, we also wanted to increase the awareness among the community, as well as healthcare professionals, that pharmacists can administer the vaccines quickly and safely. In February, we held an interprofessional immunization summit that had over 120 attendees. The summit fostered collaborations and partnerships to build the immunization neighborhood. On to the T of my TEDx talk at my presidential address this past fall. Thank you to all the pharmacy technicians in attendance of our virtual education conference. Your consistent work and support during this pandemic are truly inspiring. Technician product verification is now permanent in Wisconsin. It can provide advancement opportunities to your technician colleagues and create more time for pharmacist-provided patient care. Simply implement the technician product verification at your pharmacy. PSW has a new toolkit revised in the fall to help you implement technician product verification according to the new rules approved in the October 2019. The next update is on public health and community outreach. Supported by the Wisconsin Division of Public Health, through cooperative funding from the CDC, PSW is working with 5 specific Wisconsin counties, each located in the 5 public health regions in Wisconsin. The work is recurring in Brown, Oneida, Eau Claire, Rock, and Milwaukee counties, and is focused on building awareness around pharmacist-based services, providing templates and education on the use of collaborative practice agreements with pharmacists and exploring opportunities for expansion of diabetes prevention programs and diabetes self-management education and support. Additionally, PSW is connecting with federally qualified health centers, or FQHCs, to explore how the Medicaid CMR reimbursement program can be utilized in the unique FQHC setting across Wisconsin. This has afforded the opportunity to connect pharmacies with care coordination hubs and community health workers. The Division of Public Health funds from the CDC have also supported the creation of a cardiovascular-focused lifestyle toolkit that includes healthy recommendations for adults. This recorded session will be available for CE in the virtual PSW Educational Conference materials. The toolkit will be mailed to you following completion of the session. On to payer partnerships. WPQC accredited pharmacies have many opportunities to participate in advancing and transforming practice. PSW staff continue to support the Wisconsin Medicaid Comprehensive Medication Review and Assessment Program that pays WPQC pharmacies for continuing to provide comprehensive med reviews and assessments to complex Medicaid patients. Additionally, 2020 marks the 9th year of PSW facilitating Dane County community CMR events at senior and community centers with the support of United Way of Dane County. About 30% of CMRs per community event are now regularly provided to Medicaid patients and funded by Medicaid. Each success that PSW spearheads seems to provide additional opportunities for innovation, which is allowing for conversations with additional future partners. Between August 2019 and February of this year, PSW engaged 9 WPQC pharmacies in a cardiovascular comorbidity pilot with WEA Trust, now part of NUGEN. The goal was threefold. First, to replicate the success of our 2018 hypertension pilot through validation of patient engagement, detection of belief change, and pharmacist interventions provided. Second, to expand the work into cardiovascular comorbidities of diabetes, hypertension, and hyperlipidemia. And third, to establish proof of concept of this high-performing pharmacy network from a network adequacy and sustainable payment model perspective. Results are currently being analyzed and are looking promising. Patients' increased understanding of diabetes, hypertension, and hyperlipidemia to a statistically significant degree. We will share more details as they become available. Thanks to all the pharmacies that participated in this important work. CPESN Wisconsin, or the Community Pharmacy Enhanced Services Network, is a nationally clinically integrated network that has adopted the tenets of value-based healthcare to increase the quality of patient care and reduce overall healthcare costs. CPESN Wisconsin is focused on improving the health of patients by working collaboratively and with other healthcare providers and ensuring that patients are achieving therapeutic outcomes with safe and effective therapy. The CPESN Wisconsin network of pharmacies requires WPQC accreditation or another approved quality-based accreditation as a requirement for inclusion in the network. WPQC pharmacies have access to high-quality information created by PSW since 2008, and relationships established over 10+ years are being leveraged to continue to advance opportunities for community and ambulatory pharmacy. In August, PSW and CPESN were awarded a 2-year grant to support 6 coaching teams for 40 community pharmacies across Wisconsin with the vision of helping pharmacies to move beyond filling prescriptions at a moment in time to caring for patients over time. This group of 40+ CPESN Wisconsin pharmacies has taken the name Team WPQC with the goal of flipping the pharmacy or integrating pharmacist e-care plan documentation into community pharmacy workflow. The Practice Transformation Initiative includes building out 6 key domains through change management packages: the appointment-based model, patient follow-up and monitoring, new roles for non-pharmacist support staff, optimizing the utilization of technology and electronic pharmacist care plans, working relationships with other care team members, and last, developing the business model and expressing value. To support flipping the pharmacy, PSW is providing WPQC coaching, clinical materials, and Wisconsin-specific implementation materials to support provision of comprehensive med reviews and assessments and clinical services in the community pharmacy setting. Team WPQC leadership and PSW staff meet regularly at PSW to discuss strategies for attaining the Flip the Pharmacy goals. Plans are also in place to offer the popular telephonic coaching series as a technician-focused opportunity. To date, Team WPQC pharmacies have completed self-assessments, coaches have provided site visits to all of the pharmacies, and progress has been made in submission of e-care plans in the required domains. PSW continues to coordinate high-quality CE programming resources and tools. We have updated clinical pocket toolkits for your use. With the virtual educational conference we are rolling out, a new healthy lifestyle toolkit to support the care of patients with chronic conditions, a geriatrics and falls prevention toolkit, a pain management toolkit, and a new COPD management toolkit. The accompanying CE programs are available as standalone programs and as part of the virtual educational conference. I encourage you to check out these toolkits and the associated CE on the PSW website. Also on the PSW website, PSW has organized our online CE in a new user-friendly format. Most of the CE is available with little or no charge to PSW members. CE can now be claimed through our new platform through Lecture Panda, and CE is awarded within 24 hours of completing it. We strongly encourage all pharmacists and pharmacy technicians to check their CPE monitor portals for accuracy of reporting at least every 30 days. You can claim CE for this briefing and check out the process if you haven't seen it yet. Interestingly, Lecture Panda was developed by a pharmacist for pharmacy professionals, and it's now being used in at least a dozen other states. We hope that you will stay tuned with our virtual programming. Please be sure you regularly read the Friday Fast Facts email for ongoing PSW updates, and don't hesitate to reach out if there's something our organization, our staff team, or our board members can do to support you in our practice. Let me read that again. Please be sure you regularly read the Friday Fast Facts email for ongoing PSW updates, and don't hesitate to reach out if there's something our organization, our staff team, or our board members can do to support you in your practice. Thank you for your ongoing support and engagement. We are stronger together.